Hello, everyone. Today I will be using the Exploring Phobias presentation to teach a lesson on phobias to a middle school age audience. Middle school audience includes students from 6th to 8th grade, usually ranging from ages 11 to ages 14. This presentation will be accompanied by two handouts. The first is a KWL chart. This chart has three columns. The first column is a what I know section. The student should write what they already know about the subject being discussed in the presentation. The second column is what I want to know. Students should record any questions that they have about the subject that will be discussed during the presentation. And the last column is what I have learned. And the student should write in this section after going through the presentation and using the guided notes. The second handout is a guided notes handout. This handout will have notes from the presentation with blanks for students to fill in as they go. This way, students are not preoccupied with copying a lot of notes, but they must follow along to fill in the blanks properly. There will also be sections on the guided notes handout for them to record answers to their checking for understanding questions. Checking for understanding questions are small sections within the presentation that are designed to gauge student learning and monitor what students are learning as the presentation goes along. It's also a tool to help students with comprehension and to give the teacher some form of informal assessment before the final test or quiz is given. There will also be a pop quiz at the end of this presentation. I guess I've sort of eliminated the pop section of the quiz since I've already told it we're going to have quiz. But there will be a quiz at the end of the presentation. It's very short, and there is a section on the handout for that as well. We will begin. I hope that you enjoy my presentation and that you will perhaps listen to another one. Okay, the first thing we're going to do, students, is our warm-up activity. This activity is designed to get you ready for the lesson that we're about to go through. You should have a KWL chart in front of you right now. Please locate your chart and put it on your desk. Using the first column in our KWL chart, I want you to please list what you already know about the subject of phobias. When you finish this first task, please write down what you would like to know about phobias in the second column. This should be your W column. If you do not know anything about phobias at this time, you may use both columns to write down what you would like to know about phobias. Please be sure, if you do not know anything about phobias at this time, that you are using both columns to create questions about things that you would like to know as we go through the presentation. You should also have one more handout. This is your guided notes paper. As we go through this presentation, you will be expected to follow along and fill in your guided notes handout. The guided notes handout also includes space for all of the answers to the checking for understanding and assessment sections. Please leave the last column of your first sheet, your KWL chart, empty. You will be using this first column and filling it out at home for homework. If you need any assistance or have questions during the course of the presentation, please feel free to ask. If you have a question while I'm talking, please write it down, and when I take a breath, feel free to ask at that time. We will begin. Okay, our first slide here says, what are phobias? A phobia is an irrational fear of something. So we're going to pause at this point and discuss what we've written on our KWL sheets. Our discussion points include, and you don't have to write this down, we're just going over it. Do you know anyone who suffers from a phobia? What do you know about phobias already? If you do not know anything, what would you like to know? At this point, I would like you to turn to a partner and discuss the questions that are listed on the slide as discussion points. You have about 4 minutes to talk with your partner about the discussion points. Please keep your voice level at a level 1 so that everyone can hear their partner's responses and questioning. Thank you. Also, for anyone evaluating this presentation, the time between each slide will be modified some so that I can do the narration. But if you decide to use this for yourself, you can pace it as you would like to. Okay, what is the difference between a regular fear and a phobia? At this point, everyone should have already spoken to their partners about the discussion points and warmed themselves up to our subject here. So we're going to discuss first, what is this difference between a regular fear and a phobia? So, it's normal to be fearful of some specific things and situations. For example, if you're walking home from school and a big, huge, scary, snarling pit bull comes running in your direction with his teeth bared and his tail sticking straight up, you should be fearful. Unless you're some sort of daredevil or you're made of stainless steel. It's okay to be fearful in a situation like this. Or if you're a young child, let's say 3 or 4 or 5, and you're afraid of the dark, that's okay, as long as this fear of the dark goes away as you progress through childhood. A phobia, however, is a fear that's illogical and makes absolutely no sense. Most people who suffer from phobias know that their phobia is irrational, but they cannot stop themselves from feeling that intense fear and anxiety. Unfortunately, also, sufferers from phobias have to deal with this phobia, and as a result, it usually gets in the way of their regular life and interferes with the things that they would like to do. For example, a fear of dogs that is at a phobia level could keep you from going outside by yourself, walking home from school, going to a friend's house who has a pet. Okay, so are there different types of phobias? The answer to that question is yes. There are 3 main types of phobias. These phobias include 1, the specific phobia, agoraphobia, and social phobia. That has nothing to do with social networking like Facebook or Twitter, but it is a social phobia, and we'll discuss that later. Oh, please don't mind my jokes. I'm not that funny, but I attempt every once in a while. Okay, so we have class reached our first stopping point. Please look on your guided notes and look for your checking for understanding section 1. You should have space to answer 3 questions there. The first question is, define phobia in your own words. That means please try your best not to provide me with the regurgitation of what I've already given you on phobia. Please process what's written in your own mind and write something that reflects your thinking down. Also, are regular fears and phobias the same? Please explain your answer. And the third question, what are the main types of phobias? What are the 3 main types of phobias? Please write down your answers to the checking for understanding questions on your guided notes handout. Okay, so now we're going to get into more of our discussion. Like I said before, there are 3 types of phobias, and the first type is the specific phobia. This is the phobia that most people are familiar with. Specific phobias are discussed more often, and they're often the ones that people suffer from most often as well. Specific phobias are irrational fears of a certain object, activity, situation, or even person. And there are 5 types of specific phobias that we're going to discuss today. Those types of phobias are the animal type, the natural environment type, the blood injection injury type, the situational type, and the other type. The other is sort of a mishmash category for the phobias that are specific type, but they don't fit into the previous 4 categories. So first up, we've got our animal type specific phobia. These phobias include the fear of dogs, cats, snakes, and insects. And it also includes all other animals as well. So if someone has an animal type specific phobia, they can be scared of any animal, from ferret to raccoon. And also on a personal note, I do suffer from an animal type specific phobia. I am afraid of Fluffy Bear, the dog. The next type of specific phobia is the natural environment type phobia. Natural environment type specific phobias include those who are afraid of heights, So these people would not be climbing to the top of Mount Everest. Those who are afraid of water, those who are afraid of storms, and those who are afraid of the dark. And that does not mean the 5-year-old that is afraid of the dark and has to go to the bathroom with a nightlight. That includes the 35-year-old who's afraid of the dark and has to go to the bathroom with a nightlight. Our next type of specific phobia that we're going to discuss is the blood injection injury specific phobia. And also, I'm going to take a pause here because I can tend to move a little bit quickly. If I'm going too fast, please raise your hand and let me know. Also, make sure as we go along, you are filling in the blanks. If you get lost, or you get stuck, or you need help, please raise your hand. So again, we're talking about the blood injection injury specific phobia. We just discussed the animal type and the natural environment type. The blood injection injury type specific phobia includes the phobia of blood, getting a shot or injection, or seeing injuries or medical procedures. So those who suffer from a blood injection injury type specific phobia are the ones that are not participating in your neighborhood blood drive. They are not getting a B12 shot for energy, and they are most certainly not watching a marathon of ER or House or Nip Tuck. The next type of specific phobia is the situational type. The situational type phobia includes the phobia of flying, driving, elevators, and enclosed spaces. So if there are certain situations that people feel intense fear or intense anxiety toward, those are situational types. And then we have our last section, our other specific phobia section. These are the ones that don't fit neatly into our categories here. And that includes the fear of clowns, like this lovely one I have here on my slideshow, the fear of contracting a disease, or disease in general, the fear of loud noises like balloons popping or dishes clanging together, the fear of dogs, and all other types of fears that are specific, fears that are of certain things or certain activities, but don't fit into our other categories. For example, someone that has a deathly fear and intense anxiety at ballpoint pens or the letter S or vomit, those people would be included in the other type specific phobia category. Okay, so we have again reached another lovely stopping point. At this point, we're going to be checking for understanding on what we have learned so far. First, how many specific phobias are there? Next, name 3 specific phobias and provide an example of each type of specific phobia that you list. Please make sure that you are being specific here and providing that example that I asked for. I will be giving you a few minutes to record your answers on your guided note sheet. Again, I will ask that you are following along as we go through the presentation. Okay, so we've already discussed our first type of phobia, the specific phobia. We've moved on to agoraphobia, which is very interesting and sometimes referred to as the fear of open spaces. This definition was given before people started to associate agoraphobia with anxiety disorders and panic attacks. People who suffer from agoraphobia are afraid of being in public places or crowded areas that might cause them to panic or might trigger a panic attack. A lot of times these people are so afraid of having a panic attack in public that they will not go in public at all. These people avoid areas that are crowded like airports and malls and busy streets. Unfortunately though, like I said, these people who suffer from agoraphobia sometimes end up housebound. They find that it is simply too difficult for them to go out and risk being in public where they may have a panic attack. And the last type of phobia is social phobia. Social phobia, not to be confused with shyness, is the fear of being judged or embarrassed in a social setting. Now, many of us can relate to some sort of aversion or problem with judgment or not wanting to be embarrassed. Most people do not want to be embarrassed in front of others, but those with a social phobia have an intense fear of these things. They simply do not go into social settings where there will be any type of judgment or there's even slightly a chance that they'll be embarrassed. Sometimes there is no real reason for fear, but if there is a big gathering of people or a lot of um, socialization going on in the area where they are, they will avoid it completely. These people don't go to parties or mix and mingles. They will not engage in public speaking. And it is intense fear, it is intense anxiety, and usually it affects their everyday life. Here, what are some examples of the fears associated with social phobia? And I've already touched on some of those a few minutes ago. First, public speaking. People who suffer from social phobia will not be giving a motivational speech. Even eating and drinking in front of others. This person would be afraid of judgment from this. Getting called on in class. This student would experience extreme anxiety at the thought of being called on by a teacher in class and saying something that could be subject to judgment or cause them to feel embarrassed. And also talking to people at a party or social gathering. Most likely, those who suffer from social phobia will not even go to a party or social gathering at all. So, we're at a checking for understanding point again. We want to assess what have we learned so far. And I know that some people may feel like there are a lot of checking for understanding points, but the reasoning for that is to make sure that all of the students are getting what they need from the presentation, and as a review to make sure that we are going back over what we discussed, because we can move fast when we're dealing with the presentation here. So I want us to look at and examine these two questions here. What is the difference between agoraphobia and social phobia? Please be clear about the differences. And the second question, would someone who suffers from agoraphobia feel comfortable in a busy airport? Why or why not? Please be sure to defend your answer here. Okay, so now that we've talked about the types of phobia, which was 1, specific phobia, 2, agoraphobia, and 3, social phobia, we're going to get into some of the causes of phobia. And as I researched this to prepare for this presentation, I was very surprised at some of the causes of phobia. According to research, phobias can be caused by traumatic experiences, heredity. Some people are more likely to develop phobias if their parents or other family members have also suffered from phobias or have some sort of past with phobic suffering. Also, seeing another person show signs of fear in a certain situation could cause someone to develop a phobia. Next, reading or hearing about something that may be dangerous. For example, if someone sees a news report about the dangerous mercury that's present in Hot Pockets, note, I made that up. But if that was true and someone saw that, they could develop a phobia towards frozen pocket sandwiches. So, and that was another lame attempt at a joke. But it is true. Reading and hearing about something that may be dangerous could cause phobia. Another serious example of that would be after the 9/11 tragedy. Some people did develop a flying phobia. They would not fly after hearing about and reading about the horrific events that happened on 9/11. And the last cause of phobia that was the most surprising to me after talking to psychologists and reading very, very good information on phobias was that sometimes phobias can be caused by nothing at all. There is no explainable reason for some people's phobias. They have no clue why they have one. And although I was surprised to find that, I shouldn't have been, because my phobia that I suffer from, which is a specific phobia of dogs, I have no reason at all for having the phobia. I have no memory of a traumatic experience. No one in my family suffers from phobia. I've never seen another person show fear toward being around a generally friendly looking dog. nor have I read or seen any stories about anything happening to people as a result of being around a dog. But I developed a phobia anyway. So I think it's very interesting that sometimes there is no cause for a phobia, they just simply exist. Next, we're going to talk about the symptoms of phobia. Although there are many different phobias, those who suffer from phobias usually experience similar symptoms. These symptoms include 1. Intense anxiety. Next, a strong urge to avoid or get away from the feared object or situation. Feelings of helplessness, usually because they have some knowledge that their fear is illogical. Most people with phobias, they know that they don't have a rational reason for being afraid, but they simply can't help their fear, which does lead to those feelings of helplessness. Next is panic, and other symptoms include the physical ones, like shortness of breath, sweating, increased heartbeat, and dizziness. Okay, so we've arrived at another checking for understanding section. I need you to list the causes of phobia and then name 3 symptoms of phobia. If you list a physical symptom, that counts as 1. Please don't list 2 physical symptoms and include that as the 3 that I asked you to name for checking for understanding. So we're going to go ahead and do these 2 questions. Remember, you're recording these answers on your guided notes handout, and you should be following along as we go through. Also, you do have permission to ask questions if you need to, and if I'm talking while you have a question, remember to jot it down. Okay, so to recap, we've discussed the 3 types of phobias, which are specific phobias, agoraphobia, and social phobia. We talked about the causes of phobia. We also talked about some of the symptoms that are experienced by people who are suffering from phobias. And now we're going to actually talk about how phobias are treated. Phobias are usually treated with some sort of anti-anxiety medication and behavioral therapy. While someone could receive medication separately, as well as behavioral therapy separately, most doctors recommend that these 2 treatments be used together. Most behavior therapy involves gradually exposing the patient to his or her feared situation. So in the case of someone that is afraid of snakes, this person would gradually be exposed to that snake, meaning they would be exposed in small steps. They may have to be in the same room with the snake while it is in a cage first, and then eventually be able to open the cage and have it sit on a table. Maybe next they may have to touch the snake for a few seconds, or maybe they may have to be within very close proximity of the snake without showing fear. But either way, there's some type of gradual exposure to the feared situation so that the person can slowly start to deal with that fear and so that the fear can disappear. This type of therapy is always done by a licensed professional, that's a psychologist or a licensed therapist, and it's always done with permission of the patient. There is never therapy that is done without the patient's full consent. Eventually, the patient should be able to face their feared situation without any anxiety at all or any symptoms. And according to what I've read and the psychologist that I've spoken to, most phobias can disappear with proper treatment. So there are hope for people who face phobia. Now, there are other treatment options for those who don't wish to see a licensed professional, go through behavior therapy, or don't wish to be on any type of anti-anxiety medication. Other treatments include virtual reality based treatment, which is very much like the behavior therapy, except the therapist will use virtual reality or computer software to simulate or recreate the feared situation for the person, except they would do it in a virtual context. So instead of maybe a snake being on a table, there might be a snake on a computer screen that does things. Or they may wear some goggles and see a snake there, but there not really be one there. And the other method is self-treatment. Self-treatment is when you, the person who suffers from the phobia, undergo your own treatment. You slowly or gradually expose yourself to the thing that you are afraid of until your fear starts to go away. On your own, you face your fear and try to make that anxiety and fear lessen. And a lot of people do decide to do this type of treatment. And if that does not work, there are always other options like going to the recommended option of medication or behavior therapy. Okay, so now that we've gone through our presentation, we've done our checking for understanding and filled in our blanks, we're going to do our pop quiz here. The pop quiz has 6 questions. I'll read through all 6 questions, and I would like you to record your answers on your guided notes handout. There is a section there for you to fill in your pop quiz answers. Number 1, list the 3 types of phobias. Number 2, what is agoraphobia? Number 3, would someone with social phobia feel comfortable at a party? Why or why not? 4, name 2 causes of phobia. 5, name 1 symptom of phobia. And 6, how are phobias usually treated? I will give you 10 minutes to complete your pop quiz. At the end of that time, I will come around and collect your guided notes, handouts. You will keep your KWL chart. It is your responsibility to take that home and complete the last column of your KWL chart. That will be the learned column. I will need you to tell me what you learned as a result of this lesson today. Like I said, you will have 10 minutes to complete your pop quiz. Please be ready to turn it in at the end of 10 minutes. Okay, so in a regular classroom, it would be much longer than the time I just allotted for the students to finish their pop quiz. But I did just want to close out my narration here. Thank you for listening. Thank you for watching and being a part of my presentation here. I appreciate your time and consideration. Thank you.